Hotbed Talk.
First of all, Gerrit, who is the current president of the International Prehab Society, is going to give us just a little bit of background about the society and an update.
All right, can you hear me all in the back there? Fine, and over there, the crowd is humongous. To be serious, I'm glad that I'm standing here because we have a society that was starting to be a society, and I'll take you through the beginning. We have in Montreal our dear friend Francesco Carli, actually inventor of the ERAS program 2 decades ago, and then prehabilitation. He organized the first prehabilitation meeting, invited us all, and that's where we made programs and where we sat together in the living room setting to discuss prehabilitation with each other, and we were enthusiastic and said we have to start a movement. And we started an international study with a consortium of experts. We made a prehabilitation program, and with this consortium we had to get together once in a while, and since we were the organizing hospital for this, we thought we might as well get this consortium together in Holland and then make it an international conference. So in 2018 in Eindhoven we had what we call the second World Prehabilitation Conference, and pronounced the one that Franco organized the first. It was actually pretty much a success, and then we copied the program to the British Museum, and in 2019 we had an event with over 500 delegates from over 30 countries, and we started a movement that we thought was going to grow like a family. People all having the same idea of getting prehabilitation to patients in as many hospitals as possible and in as many countries as possible. We had big plans because after this convention, where we even prehabilitated the mummies, we moved on and we made plans and initiated the International Prehabilitation Society, bringing all different specialties together in a board to promote prehabilitation and to create a family. And the plans were there for 2020 to organize the convention in Barcelona. But then the same virus that ruined everything came along, and even the 2020 event didn't proceed. And we were thinking about going to Montreal afterwards. And we started the society, but because of COVID, our actions were so much limited that we couldn't organize any event. But we still kept going on in having discussions with the board on where to go to and how to go further. I'm standing here because we are going to merge with IPOETTS, an existing society with an administration and a tradition in organizing events like this. By doing so, we hope that we can involve the rest of the world, maybe even more, make it more multidisciplinary, and really get this movement going. This was the logo of the prehabilitation study, the consortium, and we made this the logo of the International Prehabilitation Society. And Denny will show you what we made out of a logo.
Thank you, Gerrit. So for those POETTS, or the Perioperative Exercise Testing and Training Society, and grew out really from a group in the UK who were interested in using kind of exercise testing. Increasingly, there's been a sort of a morphing towards us having very similar objectives to the International Prehab Society. So we felt, as a board, and there was some overlap on the board of the two societies anyway, that rather having two societies working in the same space, we had very many of the same aims, and that we'd be better merging, working as one, expanding the remit. And so hence, we actually had spoken to our boards and decided pre-COVID that we would merge, but then COVID intervened. So there's been a bit of a pause, but we are planning officially from today to have merged ourselves into IPOETTS, which stands for the International Prehabilitation and Perioperative Exercise Testing Society. And I suspect over time that may well just be shortened to the International Prehab Society, but it's difficult because POETTS is something that has brand recognition, and POETTS accreditation and courses have become important not only in the UK but internationally, because we've worked with Hilmi and Bernard in Melbourne and in fact with Franco in Canada, so that we could establish standardized accreditation, education and training. So we wanted to keep that alive as well. So hence the combination, and everyone quite likes the term POETTS. So we've come up with this nice new logo, which involved a lot of discussion, so I hope you like that. This is the aim of the Joint Society. It's about promoting, much as we said with exercise testing, but promoting professional practice of prehab and exercise testing. We've defined prehab here, and you can see these on the websites. I think it's really important, although we're all perioperative here, if you become interested in prehab, not surprisingly, there's quite a lot of work in the cancer arena, and I think quite rightly oncologists are increasingly aware that actually it isn't necessarily an intervention that should be limited to pre-surgical cancer treatment, but all cancer treatments. So hence, it's before treatments as well as before surgery. Increasingly, I think it's also a way to get patients earlier in the pathway. Whatever sort of cancer treatment they end up having, prehab will be beneficial. So that's why that element of the definition there. And equally, I know Sandy, for example, is now involved in end-of-life care and prehabilitation to improve the quality of patients' remaining life. So I think this may expand in terms of indications. So the aims, similar across the IPOETTS aims that we used to have, it's about delivering training and education in prehab. It's about developing the workforce and supporting the workforce development, which is different in different countries. We heard, the Netherlands are lucky enough to have physiotherapists in every village that have practices there. In the UK, we don't have that. In Canada, they have kinesiologists. In Australia, I know you have clinical exercise physiologists. Sandy will update us because she's been working on the development of that in the UK. And then it's about the development, combining data to increase the power of the sort of persuasive case to implement prehab at scale, both from audit, research and service evaluation. So trying to do that together rather than lots of small fragmented projects. I've just copied and pasted the board. What we have decided to do for the first 3 years of the cycle of the society is to merge the two boards. Now, a couple of members of various boards wanted to step down. So we have, as a result, you can see Gerrit and I are going to lead together for the next 3 years. Gerry will be the vice president, which he was within the IPS. We've got Helen here from Plymouth, who's our honorary secretary. We've got James Prentice, who can't be with us today, from Newcastle, who, along with Mike, will be in charge of the money. Importantly, we think from the multidisciplinary element, within the Constitution, we've specified that there need to be a minimum number of allied health professionals and others, such as clinical exercise physiologists, so it's not all about medics. At the moment, there are more medics on the board, but that's really historical. We've said there should be the same number of each. We didn't want to be too prescriptive, because I think really it's enthusiasm that's important as well. There are 2 trainees, and we said that one of those should come from a medical background and 1 non-medical posts on the board, which are currently vacant, so if anybody's interested in expressing information. So basically, the Constitution suggests that the membership is open to anybody, right? You don't have to be a medical professional. We thought about that long and hard, but I don't see why you have to be either a health professional. And if a patient really wants to join, I don't think there's a problem with that. So basically, anybody can join who would like to, who's interested in joining. And if you join, you are eligible to vote for who's going to be the society officers, as it were. We'll come back to the website in a little bit, but if you have joined, you'll find from our website that there are some benefits. So there is going to be a sting in the tail in terms of a subscription to the society. But if you come to a meeting, you'll have already got your subscription back, because you'll get the equivalent of your subscription off the meeting. And there will be some other good things that are hidden in the membership area of the website in terms of educational resource, business cases, and also a question and answer forum. So that's some benefits of membership. The officers on the board, you will be able to download this constitution, and we're going to have it open to commentary for the next 6 weeks. If anybody has any major issues with this, please feel free to contact us. But essentially says that we will have, beyond this first 3 years, and there's a little bit about the first 3 years, which is a bit odd because there's loads of us because we've merged 2 boards. We'll have 3 years for a president. We'll have 2 vice presidents. And the rationale for that is that sometimes it doesn't help a society if it's very clear who's going to be president for years before. And so I think it's good to have 2 people to have some backup. There'll be an honorary secretary and then a treasurer. The treasurer has lots of jobs in terms of making accounts and that sort of type thing, which really will allow the society to move forward. We will have elections which will be at an AGM annually. That's traditionally been in at this time of year. I don't really see any reason why that would change, but if you want to stand for office at those, we will inform the membership before which posts will be becoming available. One of the things we do want to make sure about, which one of our board members pointed out, is that we don't end up in a situation where everybody leaves the board instantly at the same time and we lose all that institutional memory. So we may just change the terms slightly so that there'll be some overlap, but we will take thoughts about that as well. And this is about the board outside of the officers. As I said, a minimum of 2 medical people, doesn't matter what medical background, surgeon, anaesthetic or geriatrician, whatever, 2 trainees, 2 allied health professionals, and then 3 additional board members that can come from anywhere, essentially. Things that we would like some help with, and there may be more committees, but we know that we're going to need a committee that will lead up, sort of coordinate research initiatives, and we've had some multi-centre research initiatives before that we've helped promote through the Society, or the Society have led. Education and training guidelines, and I think it's increasing interest as we implement prehab. We don't want prehab to be ineffective because it's not implemented well, or ineffective interventions are implemented. So some guidance for people, which I think is really important, because there's a lot of enthusiasm, but we want to make sure that that's directed. And then for the website to remain interesting and up to date, we actually need contributions from people. So somebody who's keen to do that. We plan to send out a members newsletter monthly, which go out to membership. So contributions to that would be great. If anybody's particularly interested in contributing any of those areas, please, again, contact us via the website, because we want there'll be one member from the board who overall will sort of oversee those areas, but we'd like other people to come and contribute to those. And from time to time, there will be, I'm sure, a necessity for projects, which is all written in the Constitution as well, about having additional people seconded to the boards who are working on a special project, be that something to do with a research project or an implementation or a guideline. So this is where you can find the new website. So it's www.ipoets.org. It will also take you there if you put .com in by mistake. We bought all of the relevant domain names so that nobody else can have them. And shortly, the other 2 websites will redirect you to this website. Be a little bit patient with us with the website. We are just in the process of moving everything across, and some of it needs a little bit of updating, but we wanted to get the majority ready so at least you could see the bones of it from today. This is what the new website, which is live now, looks like. We've got the domains and types of prehab and various resources, and you can click on these. At the moment, there's an awful lot more in exercise testing than there are the other domains. It's not that we think it's more important than nutrition. It's just that much of this has come across from the POETTS website, where there was a lot more information about exercise than other things. So if you're a dietitian and passionate about the nutritional element, it would be really great to get you involved and put some resource onto the website. Because I think one of the problems at the minute is there's a lot of signposting of patients to lots of different resources, and it would be nice to have one resource that we could have in one place. For those of you who previously were interested in CPET, or are still interested in cardiopulmonary exercise testing and the standardised accreditation, the centres have been moved, the database of accredited centres has been moved onto the new website. You can search there for an accredited centre near you if you're thinking of setting up a service. You can put in your postcode or select your trust, and they'll tell you the nearest people that are happy to mentor you if you're setting up a new service. So that's been very useful for members. And we've also got a list of CPET accredited clinicians. That might be something we do in other areas of prehab, but that's something we'll develop over time. So you can still access all of that. And we've just been going through the process of making sure the contacts are up to date for the centres, because we do find people move on, obviously. There's an education section of the website. So the cardiopulmonary exercise testing courses are advertised here. They are continuously full. If anybody else would like to start a CPET course, we're very happy to support you as well, but there's a waiting list of about 20. We run 3 a year of those. And again, we would like to expand this portfolio. And if you're running a relevant course for any element of prehab, we'd be very happy to advertise it on the website. So we're going to put Gerrit's Dutch conference, not for many of us, but for people who can obviously speak the correct language, in September, and any conferences that we're involved with. So just, again, contact through the contact bit of the website, and we can get that up. The research bit of the website. So this is just a reminder, we have an evidence area. This is, I admit, woefully not up to date. I think we last did it just pre-COVID. So again, that's a job, I hope, for one of the new trainee members on the board, Tom Abbott, who's just stepped down, did that very ably, and that we have him to thank for all the evidence that's there up to about 2019. But again, I think it's really useful. We put a direct link to the PDF if it's freely available. If there are issues with copyright, then it just goes to the PubMed link. But that's quite helpful. We've also got standardised programmes that have been used in trials, they're exercise programmes on the website there, and clinical guidelines, again, any guidance, which may be different in different international settings, we'll put on that. To join POETTS, several years ago we asked everybody in POETTS would they mind paying for some subscription so that we could maintain the website and have some help with administration. Everyone agreed to that. And the subscription, after a lot of debate, it's £40 a year for doctors and £30 a year for AHPs, others, and students and patients. One thing I forgot to mention as an update from the POETTS work, which going forward will be IPOETTS work. Some of you may have been contributed to the multi-centre evaluation of upper GI cancer patients. That has now been analysed, so next meeting we'll be able to update you with the results. It's just being written, the paper's just been written up, and we hope to submit that. So that was on behalf of POETTS, that's from 7 centres in the UK and about 700 patients. And also we are working with PQIP, again as a POETTS, now IPS group, to look at the PQIP data in a little bit more detail. I know some data was published recently from the Marsden looking at peak power output as a predictor, but looking at multivariate analysis in combination with other risk predictors, because that's prospectively collected data from centres across the UK using CPET to risk stratify, amongst other things. So those are 2 projects we were involved in. So they haven't all disappeared. We haven't forgotten you. That people have asked me about the upper GI data. I think it'd be fair to say it replicates a trend whereby it seems to be a little bit different in esophagectomy than it does in other cancers. And whether that's related to weight loss and the like, it's not quite clear. That is pretty much everything we wanted to cover. Be very happy to take questions from the floor. Any thoughts from the panel?
The past event in 2019, we had a more international crowd, and then we asked people to start a national chapter.
Yep.
And so we had quite a few people that were there that wanted to start their national chapter, and I think that's one of the things we would like to encourage as well, that there are organizations within each country that want to join and know that we have a Dutch chapter that is definitely going to join. Because I know some people in the board of the IPS, IPOETTS, so that will work out, and you probably have a chapter as well. And, that's what I would like to encourage people to do.
Yep. I forgot to mention, in terms of the annual meeting, in collaboration with EBPOM here for POETTS, there's the World Congress that Gerrit mentioned earlier, and that is a movable conference. The aim is for next year, so 2023, that will be in London at the same time as this conference. So 2023, it will be here. We're looking for venues for subsequent years. I know that quite likely in the near future, Hilmi and his team with Bernard in Melbourne in Australia may be looking to host a conference there. And I know that Canada may be keen to host again. So again, if that's something that your centre will be interested in hosting, that's something we will co-organise with the hosting centre so that we can develop a reasonably consistent programme and the like. But yeah, lots of opportunities for contributions. And I think one of the things, as Gerrit said, we want people to get involved. So this society will be what we make of it as a community, essentially. And I think centralising resources and stories will help. John?
It's an opportunity to look out.
Excuse me, time out. The audience isn't there.
Just asking,
John?
just asking if this group could look at outcomes, because I think lots of colleagues around the world are looking at outcomes for rehab. Whether they come into this group as a sort of a legacy of what everyone's doing
I think that's a really great suggestion. We had a recent sort of round table discussion about standardising outcomes, and I think it would be fair to say at the end of that the sentiment in the room was we needed to standardise interventions at the same time, but that would be a piece of work I think would be really good for us as a group to take on and someone to lead on.
I think this sounds excellent, and you know what I'm going to say, especially including allied health professionals. We've got a lot of AHP colleagues who are very enthusiastic about prehab and feel that they've got a lot to offer in terms of their rehab knowledge and expertise, and especially when you're thinking about workforce. So all I was going to say is fantastic. I think there's potentially opportunities to link with the societies and colleges. So certainly the Royal College of OT, the Chartered Society of Physiotherapy, the BDA, all of those, because I know there's internal conversations happening within those societies about prehab subgroups. And again, rather than have a very disparate, if there was a way of kind of making those links, I think that would be really positive.
I think that's brilliant, which has also just reminded me, because Sandy, you were meant to be giving us a brief up on that basis. Sandy's been doing some work with others about development of the exercise, specifically workforce, in the absence of what you've had for a long time in Australia, which is clinical exercise physiologists. So,
well, Australia have helped us. So clinical exercise physiologists were not recognised or registered as professionals. I've been harping on about this and saying they should be registered as professionals and have indemnity. I'm pleased to say that I'm part of a steering group that's led by Helen Jones at John Moores University in Liverpool. And now the registration has been accepted by the Registration Council for Clinical Physiologists as a protected title of clinical exercise physiology. And our organisation is Clinical Exercise Physiology UK. And also they have basis accreditation as well. So within that they have their indemnity. So it's a good and great new era for clinical exercise physiologists, and thank you to ESSA and Australia for helping us lead the way.
Yeah, I think that's, typically understated from Sandy, but that's been a really massive piece of work, because delivery of this, as I think we've all heard today, is going to be in the community, and we didn't really want to exclude a workforce which has been excluded because there's just been no way for them to register themselves as clinicians, which means that if they prescribe exercise that goes on in the community and something happens when the patient's exercising, they're personally at risk, and we can only indemnify them with trust indemnity within the hospital. So that's been a really hard situation for those, really enthusiastic, and there's lots of exercise physiologists, so I'm really pleased by that development. But those are the sort of things we can do, as you said, together. So that's great, great progress. And on that note, I think there's loads of scope for more courses, both virtual and face-to-face. Lots of people constantly ask, how do we do a 6-minute walk test? How do we do the get up and go test? How do we do all of these shuffle walk tests? So, I think lots of scope for one-day courses to make sure that these things are being implemented. How do we do a nutritional assessment? I think that's really hugely important. How do we assess frailty? That sort of stuff.
Just a comment about, was it a recent Freedom of Information request suggested that about 50% of UK trusts have a prehab service. So I think it's going to be important for us to get the message out to all of those other people across internationally and so on. And we've got to think of a strategy about how we're going to do that, because there's probably a lot of people who will be interested in being involved but won't know about us.
Yeah.
And it's kind of, there's going to be a lot of word of mouth, but we have to work on together getting the message out so that other people can know what we're doing and be part of the kind of journey.
Yeah. Rachel, go ahead.
Yeah, just on the back of the Freedom of Information request, Jerry, I was involved in that, and Maria Puffelet, who led on that, we've decided that we're going to actually publish it in the Health Service Journal. And the reason for that is to, exactly like you said, to reach the commissioners, managers, finance directors who read that. It's going to be published clinically, but also managerially in service development, because it's such an important piece of work with such a high uptake. So, thanks for making reference to that. And I'm not sure if Maria's here this week.
She's not. No. Yes, I don't know if you received that, but I was quite surprised at the 50% of trusts. Yeah, it was 60, I think. And 20% which had recurrent funding.
Like the direction that we're taking with the merger. But just a suggestion, in Australia we've been able to secure funding for training fellows, so trainees in 3-month blocks in rehabilitation. And we're going to insert these 3-month blocks into the Perioperative Medicine diploma that's run by the college. think it'd be interesting to see whether there is a prospect of also, through IPOETTS, come up with recognized centers for having people come in for 3 months and train in prehab, whether it be at a medical level or like health level or even nursing level. So like the accredited centers for POETTS, if we can also have accredited centers for prehab training.
I think that's a really interesting idea, and exactly that, because you want to spread best practice. So I think that's certainly something we could look into.
Just wanted to say one thing. Having been involved with a lot of professional organisations over quite a lot of years, they more often tend to diverge and people create kingdoms, and it's a really impressive and cool thing to do, to actually combine and focus and try and pool resources rather than like this.
Thank you. Thank you. That's a very important bit to stop.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.